We studied patients with relapsed multiple myeloma who had 1114 translocation, and originally did a phase 1 study of the combination of Venetoclax, Daratumumab, and Dexamethasone, and found a very high response rate in that patient population with over 95% response rate, and at 18-month follow-up, 90% of the patients remain progression-free. What I'm reporting today is the randomized study of 2 different doses of Venetoclax in combination with Daratumumab and Dexamethasone, and a third arm using the combination of Bortezomib, Daratumumab, and Dexamethasone to provide context both from an efficacy and, more importantly, from a safety perspective, given what we learned about Bellini and the concern for early toxicity and infections. These patients had relapsed and refractory myeloma. They had to have at least 1 prior line of therapy, and in a 4:2 to 5 randomization of Venetoclax at 400 milligrams daily with standard Daratumumab and Dexamethasone, to Venetoclax at 800 milligrams daily in combination with Dara and Dexamethasone, and then the 5 was the combination of Bortezomib, Daratumumab, and Dexamethasone. What we found is that we could deliver both doses safely, and again had a very impressive response rate, 87% response rate versus approximately 60% for what I consider the control group, the combination of Bortezomib, Daratumumab, and Dexamethasone. And most importantly, from a safety profile perspective, there was no increased risk of the Venetoclax arm. There were no deaths while on study, and the infections were the infection rate and the serious and life-threatening infection rate were very similar between the Venetoclax arms and the Bortezomib arms. We have preliminary data that some of these some of the responses are MRD negative responses, and we are planning on completing this study and looking to design phase 3 studies with looking at the combination of Venetoclax, Daratumumab, and Dexamethasone.